Okay, so anyone out there listening who's prepping for the MRCS knows time is precious, right?
For sure.
So today we're diving into surgical drains. And this is something that you will definitely see on the exam and then in your practice.
Absolutely.
So we have the textbook chapter here, and we're going to try to extract some of the essential nuggets that you're going to need to know. And we're going to go a little bit deeper than just like listing out the types of drains.
Yeah.
We really want to get to like the why of using them.
Absolutely.
And the mechanisms behind different designs and some of those tricky complications you got to watch out for.
That's key.
Yeah.
It's so important because, drains are all about manipulating fluid dynamics.
Right.
Within the body, it's like this whole hidden world of how we use these little tools to promote healing and prevent complications.
Right.
So, it's more than just memorizing names,
Totally. Yeah. So the chapter kind of starts out talking about two main ways that drainage is used.
Okay.
So there's external and internal, and external drainage I feel like is pretty straightforward.
Yes.
You're creating some sort of pathway for things to exit the body.
Yeah, exactly. Like a colostomy.
Exactly. Yeah.
You're creating a stoma.
Yeah.
Allowing things to come out.
Right.
Yeah.
But internal drainage, that's a little more like...
Yeah, it's a little bit more subtle.
Mind-bending.
Yeah, exactly. It's like...
So how does that work?
So think about it this way. Imagine you're doing a gastroenterostomy.
Okay.
Right.
Yeah.
You're creating a new pathway.
Right.
For gastric contents to flow.
Yeah.
That's internal drainage.
Okay.
You're redirecting flow within the body, not necessarily removing anything completely.
Yeah.
It's all about strategically manipulating those fluids. Yeah.
Where'd they go?
So it's not about just like sticking a tube in.
Right.
It's really like understanding the anatomy.
So thinking about the flow.
A flow.
Exactly.
Yeah.
So, okay. So the chapter highlights 4 key reasons why surgeons use drains.
Okay.
So let's talk about those.
Right.
Hit me with number 1.
All right. So number 1, think infection.
Okay.
Right. So you've got a surgical site. There's some nasty infection. The drain comes in. It's like your little superhero.
Okay.
It's removing that pus, those infected fluids.
Okay.
Giving the body a chance to heal.
So infection control.
Absolutely. Number 1 priority.
Top of the list.
Always.
What about number 2?
Number 2, dead space. So imagine you remove a large tumor.
Okay.
Right. You've taken out this big chunk of tissue. What's left behind. Avoid this dead space, as we call it. It can become a problem because fluids love to accumulate there.
Right.
They just hang out, they party, they cause trouble.
Yeah. A drain comes in. It eliminates that space. Yeah. Prevents that fluid buildup.
So that's like preventing a flood by like giving the water somewhere to go.
You got it.
Okay. That makes sense.
Yeah.
What about the other 2?
Okay. So the other 2 are about monitoring and therapeutics.
Okay.
Number 3, even with the best surgical technique.
Yeah.
Sometimes things can go wrong.
Right.
Right. You might have a little bit of bleeding, a tiny leak from an anastomosis that you didn't even see. The drain acts like a little canary in the coal mine.
Okay.
It's an early warning system.
Right.
If we see unexpected output, we know something's up and we can intervene quickly.
Okay, so it's like a built-in
alarm system.
Alarm system. Okay.
Right there.
Got it. And then the final one.
Okay, the final reason is for creating what we call therapeutic pathways.
Okay.
It's about guiding the flow of bodily fluids in a way that promotes healing.
A classic example is a T-tube after gallbladder surgery.
Right.
Make sure that bile drains properly while things are healing up.
Okay, yeah.
Yeah.
So, okay, we've talked about like why we use drains.
Right.
Now let's talk about all the different types.
Okay, let's do it.
So the textbook talks about active drains, passive drains. What's the difference?
All right, so think of it this way.
Okay.
Active drains, they're like little vacuum cleaners.
Okay.
They're actively sucking out fluids.
Right.
Passive drains, on the other hand.
Yeah.
They're more like a gentle slope.
Okay.
Relying on gravity to do the work.
Gotcha. So like the active ones first?
Yeah, active ones.
What are those?
You've got open systems like the sump drain, which is pretty cool.
Okay.
It's got 2 lumens, one for suction and one for venting.
Okay.
This design prevents blockage, which is key.
Okay.
Because it can handle thick fluids and debris.
So that's why it's got that like double tube kind of thing.
That double lumen is what makes it so special.
Okay.
Yeah, it's really ingenious.
And then what are some other active ones?
Then you've got your closed systems, like the Redevac and chest drains.
Right.
You'll see these connected to underwater seals a lot of the time.
Sure.
Maintain that controlled suction.
Right.
Yeah.
Okay, and then those are the active ones? And what about the
passive ones?
Passive ones.
Yeah, so passive drains are a bit more laid back. They're not as fancy.
Right.
But they're still really useful.
So what are some examples?
Okay, so you've got your open passive drains.
Okay.
Like gauze wicks or setons.
Yeah.
These are good for smaller wounds or abscesses.
Okay.
They just kind of weak away the fluid.
Right.
And then you've got closed passive drains, like the Robinson drain.
Okay.
Which uses gravity and capillary action to get the job done.
Okay, so I'm like a surgical resident.
Yeah.
Prepping for the MRCS.
Mm-hmm.
How do I know which drain to use?
That is the million-dollar question.
Right.
It's a good one.
Like, when do I use which one?
It all comes down to clinical judgment.
Okay.
You got to think about the location of the surgery, how much drainage you're expecting,
right,
and the potential for complications.
Oh, well.
So, for example, if you've got a simple subcutaneous collection, a Robinson drain might be all you need.
Okay.
But if you've just done major thoracic surgery, you're going to need a chest drain to manage that serious fluid output.
Right. It's a lot more
that
tailoring it to the individual patient.
Yeah.
Yeah.
That makes sense.
Good.
Now I'm thinking about like all the things that could go wrong.
Oh, yeah.
Even with like the perfect drain selection.
Right.
So what are some complications we need to watch out for?
All right. So complication number one, the one we're always thinking about, is infection.
Right.
No matter how sterile our technique is, drains can act as a pathway for bacteria to get into the body.
Yikes. So that's always top of mind.
So infection control, we got to really pay attention.
Next paramount.
Okay. And then what else can happen?
Another big one is damage to nearby structures during drain placement.
Right.
Think about it.
Yeah.
You've got bowels, blood vessels, nerves.
Right. All that stuff.
All these vital structures in close proximity.
Yeah.
A slip of the scalpel could cause serious problems.
It's like a minefield down there.
It's like a minefield.
Yeah, you really got to know your anatomy.
You got to know your anatomy inside and out, that's for sure.
And then any other complications?
Well, you can also have obstruction, migration, or displacement of the drain.
Okay.
These can happen for all sorts of reasons, from kinking of the tubing to patient movement.
Right.
We've got strategies to try and prevent these, but they're definitely things we're always thinking about.
So it's like a...
It's a balancing act.
Balancing act, yeah.
Choosing the right drain while being mindful of those potential pitfalls.
Yeah, so surgical drains are a bit of a double-edged sword.
Exactly.
They're essential.
They are.
But they come with risks.
They come with risks.
Yeah.
So
that's why understanding them is so crucial for any aspiring surgeon.
Well, we covered a lot of ground today.
We did.
We talked about why we use them, different types, and even the potential complications.
Oh, the good stuff.
But this is really just the beginning.
Oh, yeah, for sure.
Of your drain journey.
This is just the foundation.
Right.
Yeah.
So anyone out there prepping for the MRCS, here's a little challenge.
Okay, I like it.
As you're studying different surgical procedures, ask yourself, what kind of drain would I use in this case?
Good question.
And why?
Exactly.
Think about location, drainage amount, potential complications.
You got it.
That's how you take this knowledge from the textbook to the OR. That's the key. That's how you make it real.
Keep those brains churning.
Keep thinking about it.
And we'll catch you on the next deep dive.
Yeah, see you next time.